Hydroxychloroquine is back in the news again. You'd say there's something about this drug and the pandemic. Well, we're still staying with Dr. Stella Emmanuel's video in which she claimed the drug hydroxychloroquine is a cure for the virus. Similarly, a professor of epidemiology at Yale University, Harvey Risch, also says the drug is the key to defeating the pandemic. Why is there a hush around this, you'd ask? Is there a way it should be prescribed? Well, we'll be looking at these and many more tonight, right after the COVID-19 cases. As the arguments are back and forth and the quest for vaccine is on, the numbers are on the rise. As the cases worldwide is now over 16.7 million infections. The deaths are over 600,000 and recoveries are over 9.7 million. Right here in Nigeria, the current figures stand at 41,000 cases with 868 deaths and over 18,000 recoveries. This is COVID-19 Myths and Facts. I'm Onimisi Adaba. Welcome on board. So yesterday, social media was abuzz with a primary care physician who was trained in Nigeria and is based in Houston, Texas, Dr. Stella Emmanuel, who claimed there is a cure for COVID-19. The reaction still trailed in today. She claims to have treated more than 300,000 patients with hydroxychloroquine, zinc, and azithromycin, and none has died.
I'm Dr. Stella Emmanuel. I'm a primary care physician in Houston, Texas. You know, I actually went to medical school in West Africa, Nigeria, where I took care of malaria patients, treated them with hydroxychloroquine and stuff like that. So I'm actually used to these medications. I'm here because I have personally treated over 350 patients with COVID. Patients that have diabetes, patients that have high blood pressure, patients that have asthma, old people. I think my oldest patient is 92, 87-year-olds. And the result has been the same. I put them on hydroxychloroquine, I put them on zinc, I put them on azithromycin, and they are all well. For the past few months, I've taken care of over 350 patients. We've not lost one. Not a diabetic, not a somebody with high blood pressure, not somebody with asthma, not an old person. We've not lost one patient. And on top of that, I've put myself, my staff, and many doctors that I know on hydroxychloroquine for prevention, because by the very mechanism of action, it works early.
So the United States President, in reaction, Donald Trump, has also defended the use of hydroxychloroquine to ward off the coronavirus, contradicting his own public health officials. He said the malaria medication was only rejected as COVID-19 treatment because he had recommended its use. He remarked, or his remarks come after Twitter banned his eldest son for posting a clip promoting hydroxychloroquine. There is no evidence that the drug can fight the virus, and regulators warn it may cause heart problems.
Recommendations of many other people, including doctors. Many doctors think it is extremely successful. The hydroxychloroquine, coupled with the zinc and perhaps the azithromycin. But many doctors think it's extremely good, and some people don't. Some people, I think it's become very political. I happen to believe in it. I would take it. As you know, I took it for a 14-day period, and I'm here, right? I'm here. I happen to think it works in the early stages. I can only say that from my standpoint, and based on a lot of reading and a lot of knowledge about it, I think it could have a very positive impact in the early stages. And I don't think you lose anything by doing it, other than politically, it doesn't seem to be too popular. You know why? Because I recommend it. When I recommend something, they like to say, don't use it.
So joining me via Skype to make sense of this and tie up the loose ends based on our experience back home is Dr. Ali Usani. He is the National Coordinator of the Presidential Task Force on COVID-19. Thank you for joining in, Doctor.
Thank you for having me.
All right. So As the coordinator of the PTF on COVID-19, what do you make of this? It's been, the drug has been in the center stage ever since. People want it, people don't believe in it, there are stories left, right and center. What do you make of this?
Well, as you know, when it comes to medicine, we have a specific way of finding out whether drugs work or not. And this is a scientifically validated, robust method applicable worldwide. What we do is we do a randomized control trial. The randomized control trial will compare the drug with another, what we call a placebo, an inactive drug, or some other medications to see whether there's impact or efficacy. At the moment, there's no evidence that hydroxychloroquine provides any efficacy or reduces mortality. Mortality is the death rate when it comes to COVID. In fact, some of the trials, like the Solidarity trials, the French recovery trials, the UK discovery trials, all showed a trend towards increased risk of heart toxicity with hydroxychloroquine. I think it's unfortunate that both COVID as the disease itself, as well as the drugs that could potentially be used, are being heavily politicized. And again, I must caution that anecdotal evidence means that evidence that you get from an individual giving a drug to a patient. It's the weakest evidence scientifically. It's the weakest evidence scientifically. And we know from the past that when drugs are not subjected to robust trials, you tend to end up with a problem. A typical example was thalidomide, which was used for many years back for treating pregnant women with nausea or tendency to vomiting. And this drug resulted in a lot of children being born without limbs. Now, we know hydroxychloroquine has been with us for a long time. Chloroquine itself has been with us for a long time, being used as an anti-malarial drug. We know there have been theories around how it could possibly be used to treat COVID infection. In terms of the hypothesis, how it could possibly act, etc. But theory is different from practice. At the moment, there is absolutely no evidence that hydroxychloroquine has any efficacy against coronavirus, which is a viral infection, by the way. Mm-hmm. Neither does hydroxychloroquine have any activity against any viral infection. Hydroxychloroquine is pretty good for parasitic infections like malaria, for instance.
Okay, so is there a way this drug should be taken? Or seem to be losing contact there. Is there a way the drug should be taken? Doctor, if you can hear me, is there a particular way that the drug can be taken against just popping it straight up like that? I remember or recall the Dr. Stella mentioned other drugs that she administers the hydroxychloroquine with. Must it be taken with other drugs, or is there a particular way it should be taken?
As I said, hydroxychloroquine, as far as we know based on clinical trials at the moment, taking hydroxychloroquine in the context of coronavirus infection causes more harm than good. Okay? Hydroxychloroquine has been used in addition to other drugs, like azithromycin, for instance, that people use with hydroxychloroquine. Azithromycin is an antibiotic. It's used to treat pneumonia. Pneumonia is one of the commonest presentations. Bacterial pneumonia is one of the commonest complications of coronavirus infection. So if you use azithromycin, you're treating the bacterial pneumonia that could secondarily complicate a coronavirus infection, in the same way that if you use another antibiotic like cephalosporin. So zinc, which sometimes they add, there's absolutely no evidence that zinc has any activity against coronavirus infection. Neither does it have activity against other respiratory viruses such as influenza, etc. Which is why I keep on saying that anecdotal evidence is not evidence in itself. We need to be careful what we promote. If a drug does not work, there is no point in taking it, because inevitably you will find harm when it comes to giving this drug in a certain proportion of patients. You could say, well, what's the harm in giving chloroquine? Well, chloroquine does harm if it is taken at the wrong dose or if it is not taken for the right reason. It can be taken for autoimmune diseases like lupus, but even in lupus, we monitor for toxicity, eye toxicity, for instance. So it's not simple to just say, let me take chloroquine in case it works, because I'm afraid that's not how medicine works, really. And I certainly wouldn't rely on a politician to tell me whether a drug works or not.
Okay, so but we have this Professor Harvey Risch from Yale University. He is actually a professor of epidemiology who says it is the way to defeat COVID-19. Shouldn't that count?
So it will count if Professor Harvey has done a randomized control trial comparing hydroxychloroquine or any other drug he favors with either a placebo or a comparator, and it's been peer-reviewed and published. In which case we would say, yes, well done, Professor Harvey, we'll go with you. But you cannot wake up just one day and say, I believe this drug works, without providing the clinical evidence based on clinical trials that have been validated over the years. It's the reason why if a drug comes out, like paracetamol, for instance, or an antibiotic, you'll go and buy it with confidence. It's because it's undergone a rigorous process. It's because it's not based on somebody else saying that it works. So we have to be very careful here. Individual academics, whatever their position, need to go through the normal process that we expect everybody to. If I come up with a vaccine today, I'm not going to come out with a vaccine and just say, let's give it to Nigerians, it works. No, I'll have to put it through a process. And that's what we're saying. We shouldn't forget that medicine is based on science. Medicine is not based on any other perception or belief, etc. It's based on facts. It's based on evidence. It's based on what you see when you do a clinical trial or you do a research. And that's what we should really be going on. Coronavirus, COVID infection is not an infection where you start trying all sorts of things that do not have evidence. Let's try and stick to what we know has worked for years. A process that we know we trust, a process that we know is safe, a process that we know comes with efficacy, rather than trying to promote drugs that have absolutely no evidence. Even within our case management side, in the country, our guideline at the moment does not contain hydroxychloroquine. We took it out based on the evidence that was emerging. And we have no intention of putting it back in unless the evidence changes.
Okay. Thank you so much, Dr. Ali Usani. He is the National Coordinator of the Presidential Task Force on COVID-19. We appreciate you sharing thoughts with us in this regard. And that's all we can take tonight. Now, don't forget to stay with the NCDC guidelines. My name is Onimisi Adaba. Thank you for watching. You take good care and stay safe.